Your second year. I am Dr. Siham Al-Araj. I will be giving you the lecture about the oral mucous membrane, part 2. This lecture will give you a more clear view and more profound to the knowledge that was in the last lecture. I hope you will enjoy. So we will learn in this lecture the oral mucosa according to the sites: the lip, the buccal mucosa, the gingiva, the alveolar mucosa, the palate, the floor of the mouth, the tongue, and finally we will have some clinical considerations. So in the last lecture we have described the oral keratinized epithelium with some characteristics, as they firstly keratinize, which means they will become loaded with more keratin tonofilaments. They have intracellular junctions, notably tight desmosomes. They have mitotic activity and they divide continuously. They are on multiple layers and they do mature and differentiate as we go to the upper layer. We have desquamation or shedding of the last layer, uppermost layer, and it stains for the hematoxylin and eosine stain. They are derivatives from neural crest or the bone marrow. We have also described types of the oral mucosa according to the function. Firstly is the masticatory mucosa, which are of the 25% of areas that are subjected to masticatory and high friction forces. It is firm and rubbery in texture, which is composed of the hard palate and the attached gingiva as free marginal gingiva and the interdental papillae. This is mostly a keratinized epithelium. Secondly is the lining mucosa, composing most of the area of the membranes, oral membranes. It consists of non-keratinized epithelium and can be divided into the alveolar mucosa, the buccal mucosa, the soft palate, ventral surface of the tongue, floor of the mouth, and the lip. The third type according to the function is the specialized mucosa, which is different from the other two previous parts. It is composed of the vermilion zone of the lip, the junctional dentogingival epithelium, the dorsum of the tongue, and also the lymphoid tissue and the lingual tonsils. In this lecture, we will start with the lip. The lip has three sides: the skin side on the outer surface, the vermilion zone or the vermilion border, which is called also the transition or the red zone, and in the inner side is the labial or the oral mucosa. We see a striated muscle, the orbicularis oris, in the submucosa, and also some minor salivary glands. The skin of the lip is surely keratinized epidermis, and there is a connective tissue dermis. They mostly contain hair follicles, sebaceous glands, and sweat glands, as seen here in this slide.